So today we'll be starting off our community stream sessions. And today we'll be starting off with epidemiology, and we'll be just looking at an introduction into epidemiology. So let me just share my screen here. Right. So I hope everyone can see my screen. Right. So let's start off with an introduction to epidemiology, right? So this is basically one of the most important topics in community medicine. It's sort of like the backbone of community medicine. It's somewhat similar to how anatomy is important for surgery. So epidemiology, basically, you need it to learn and to build on for all the other things in public health and community medicine. And for you, it is important because this is a very common question area for your exams. So in epidemiology, so I do apologize. It's raining a bit heavily here, so there might be some disturbances. So just let me know if there's any problems with the audio. Right. So for epidemiology at your level, what's expected is these 5 things, just these 5 things, right? You will need to know a basic, you will need to have a basic understanding of what epidemiology is, a little bit about its definition, and then a vital component of epidemiology is epidemiological research. So you will need to know the basic steps of doing a research. What are the basic steps of what are the basic steps in doing a research? And then in that research, one of those steps is choosing a study design for your research. And that we'll be looking into today in detail. What are the different study designs which are available? And so you will be basically learning about different study designs. And for each of these study designs, you will need to know about what it is, and then you will also need to know about basically what are the advantages and disadvantages of each study design, and then you will need to know about how we practically use them. So then there's something called epidemiological measures you will have to learn about, and then there's tests, basically screening tests. You will have to know a little bit about screening tests as well. So in today's session, what I hope to cover is just the first three, these three, the definition, a little bit about the research, the basic steps of doing a research, and then a little bit about a little bit deeper into study designs. What are the different study designs there are, and what each of them mean, and what are the advantages and disadvantages of each of these study designs. So basically, this is the type of question that you will expect. So basically, at the end of this presentation, at the end of this session, you will be able to answer these types of MCQ questions. So this is a true-false question. So let's just look into it. And when you go through the presentation, little by little, you will be able to answer these things. So this question says that Dr. Kasun is a medical officer at a diabetic clinic in a hospital in Sri Lanka. He wants to find out how well patients with diabetes manage their blood sugar levels in their hospital. To do this, he wants to check their fasting blood sugar and HbA1c levels. So the way he checks the diabetic control is through fasting blood sugar and HbA1c levels. So that's one part. Next, another doctor in that same unit wants to find out the factors associated with good glycemic control. Basically, what are the factors or what are the other things that are associated or that might cause people to have good glycemic control. And to do this, what she does is she takes people from the clinic and divides them into 2 groups. She groups participants or patients into patients with good glycemic control and patients with poor glycemic control. So then, true or false regarding the following statement. Number 1, Dr. Kasun will have to do an audit. So basically, like I told, you will have to know what research is. Then you will have to differentiate a research from an audit. Then next, the first step of Dr. Kalani's research would be to decide on study methods. So we will be learning about the study, about the research steps, and there are certain steps you need to follow in order. Next, Dr. Kalani's study is a descriptive study. So like I said, there are different study methods, there are different study designs, and so we will learn about those as well. So one of those study designs is something called a case control study. So case control studies can be done within a short period. The other last statement is temporal association can be established in case control studies. So by the end of this, you will be able to answer all 5 of these steps. So let's go step by step. So what is epidemiology? Let's start off with the definition of epidemiology. So basically epidemiology is, it is defined as the study of distribution and determinants of health-related states or events in populations and application of this study to control health problems. It's a bit long, but very simple once you get into it, right? So the main thing here is health-related states or events. So this can mean either disease, this can be a disease, or it can be a risk factor, or it can be a behavior. So that's what we are studying about. That is our main aim. So we can study about diseases, we can study about cancers, we can study about NCDs, non-communicable diseases, or we can study risk factors. We can study smoking as a risk factor for lung cancer. We can study unhealthy diet as a risk factor for obesity. So we can study risk factors as well. On the other hand, we can study behaviors. So diseases, risk factors, and behaviors are our main target in epidemiology. And in that, what are we looking for? So we are looking for the distribution and determinants of those either diseases or risk factors or behaviors. So what do you mean by distribution and determinants? So distribution is how a disease is spread. And there are 3 ways a disease can be distributed in a population. We call this distributed in time, place, and person. So basically, if you had, so these things you will already have somewhat of an exposure. If you watched the news broadcast during our COVID-19 outbreak, during each news broadcast, all these 3 aspects of the distribution of COVID-19 was displayed. So what was the very first graph they showed when during the COVID-19 outbreaks in the news? So the very first graph was a bar chart which showed the number of cases, right? Basically, they show the number of cases today. Another bar was for the number of cases yesterday, another one for day before yesterday, and so on. So that showed the distribution of COVID-19 across time. So that showed the distribution of COVID-19 across time. So they had a bar graph like this, right? And the next graphic that they showed was, what was it? They usually showed a map, right? After this, they showed a map with the different districts color coded to show how many cases there were in each district. So basically, every time it would be Colombo, Gampaha, and Kalutara, which had the highest number of cases, which would be in bright red. So that was a display of, that's a graphical representation of how COVID-19 was distributed distributed across the place or the districts, right? So then the next graphic was, they also usually showed the different how many males were affected, how many females were affected, how many people were affected who were above 85 or 65 years, how many children were affected. So they showed stuff like that as well. So that is how COVID-19 cases and COVID-19 incidents was distributed among people. So that is what distribution means. It's distribution according to time, place, and person. So these are similar graphs which show, so this is a graph which shows the distribution or deaths caused by what I think is stomach cancer, gastric cancer, over the past decade or so. So this shows the distribution. This is a graphical representation of the distribution of that disease over time. And this shows the distribution of gastric cancer over different countries. Basically, if you just zoom in, you can see that the red colored ones are the countries with the highest density, and the blue colored ones, dark blue colored ones, are the ones with the lowest density. And you can see that Japan has the highest density. So this is distribution of gastric cancer across places or countries. And next, so this is a simple graphic which shows the distribution of lung cancer across the 2 genders, male and female. So you can see that males have slightly more newer cases, and males have slightly higher risk, and all those things, details you can gather from these things. So distribution means these three things: time, place, and person. Clear, I hope. Right. So next, determinants. When you're talking about determinants, the next part of epidemiology. So in epidemiology, like I said earlier, our main target is health-related states, which can mean diseases, risk factors, or behaviors. And what are we going to look at in those? We are going to look at the distribution of diseases or the determinants of diseases. So distribution is time, place, and person, and determinants means what is causing these diseases, what are causing these risk factors. So determinants can be either causes, they can be causative agents, or risk factors. So either of the two, epidemiology can figure out. So basically, that is what it means to, that is what is the meaning of epidemiology. So it is the study of the distribution, time, place, and person, and the determinants, what is causing this, of health-related states or events, which basically means diseases, risk factors, or behaviors. And then we are not going to stop there. After we find out how these diseases are spread, what is causing this disease, then we are going to look at how to control or prevent this disease. And that's the last part of that definition. So basically, in a nutshell, this is what epidemiology is. Epidemiology is finding out the distribution, finding out the determinants of some health event. It can be diseases, most often it is diseases, but it can be other things as well. And then using that knowledge to control those diseases, to prevent those diseases, to somehow to control, prevent, and prevent any further spread of those diseases, basically. So then how do we do it? How do we find out the distribution or determinants of a disease, of a risk factor, whatever? How do we do it? So there are two ways. One is where you can use routine data, right? You can use routinely collected data, which was what happened in COVID-19. Basically, there was people routinely collecting data at MOH level, at medical officers of health, and at hospital level, they were finding out how many new cases there are, how many deaths there were, and they were sending it to the national level, to the Ministry of Health. And that was how they created all those graphics. On the other hand, if you don't have routine sources of data, if you don't have a place to get this routine data, then you have to do something called research, right? So research, we will look at the definition of research. So research is basically a systematic investigation into a certain event, which hopes to uncover new information and new knowledge about that topic. And so before learning strictly about research, it's also important to compare it with audit, because this is a frequent thing that can come up in your exams. You will be asked about what is this, you will be given a scenario and asked, is this a research or is this an audit? You can be given something and asked, are you going to do a research for this, or are you going to do an audit for this? So basically, a research we'll look into first. A research is a systematic and methodological investigation which is designed to generate new knowledge. That is one thing. Research always generates new knowledge. It's something new that wasn't there earlier. And whatever you find from that, whatever thing you find from that, you can apply beyond the study population, which means you can generalize it, or you can extrapolate it, or you can apply it to other populations as well. For example, if you do a research in Sri Lanka to see whether smoking causes lung cancer, if you find that smoking causes lung cancer, that is something that finding is general to all people anywhere, even to other countries, right? So that is what is meant by research. You are gaining new knowledge. You find out smoking is a risk factor for lung cancer. And the results you get can be applied to other populations as well. Even if you do it in Sri Lanka, the results are valid to other countries as well, depending on certain factors, which we will go into later. So that is what is research. So then an audit, on the other hand, is a systematic review, and we usually do this for managements or treatments, where you review it and compare it against a standard or a certain benchmark. And you do it within a specific context. Those are the two defining features. Number one, you compare with the standard or a benchmark or a protocol, established protocol. And this is specific to a certain context or institution. So for example, if you send a patient to the labor room, there is a certain expected way you're supposed to manage that patient. Within coming to that labor room, a certain patient would be expected, the nursing officers or the health staff would be expected to start a partograph. They will be expected to monitor the well-being of the mother. They will be expected to monitor the well-being of the child. So they will have to put CTGs at a certain frequency. They will have to monitor the fetal heartbeat at a certain frequency. So those are standards. So those have already been found. Those are protocols. Another example would be like a person coming with a suspected myocardial infarction. So in other countries, and even in Sri Lanka, there are standards for how these patients should be managed. So a patient like that should be managed within 10 minutes. They can have a protocol saying that within 10 minutes they should get an ECG. Then within a certain amount of period of time, if they are confirmed as an MI, they should get aspirin or clopidogrel. And then if it's indicated within 90 minutes, they should undergo reperfusion therapy or thrombolysis, whatever. So there will be a protocol. And what you do is you take that protocol and you see whether a certain institute is adhering to that protocol. That is what is called an audit. So that is not a research. You're not generating new knowledge. You are just looking, you are just seeing whether people are adhering to a certain protocol, to a certain standard, or to a certain benchmark. And that is specific for that location, right? So I hope you got the basic understanding of what is a audit. So let's look at two scenarios and see whether you understood it. So here, a team of researchers want to test the effectiveness of a new antihypertensive drug. And they randomly assign patients to receive either the new drug or a standard treatment. So they have discovered a new antihypertensive. So to see the effectiveness of it, they give this drug to a group of new drug to a group of people, and they continue the old treatment in another group of people, and they measure the blood pressure changes of these two groups over 6 months to compare the outcomes. So is this a research or is this an audit? So here basically they are testing out a new drug. So this drug hasn't been tested before, so they are generating new knowledge on that drug. They are generating for the first time whether this drug is, they are finding out for the first time whether this drug is effective or not. So that is generation of new knowledge, and if they can use this, if they can do this study, they can apply this to other populations as well. So this is an example of a research. Then what about this situation here? A hospital notices an increase in postpartum infection among mothers who had vaginal deliveries. The obstetric team decides to review medical records over the past 6 months to assess whether labor room staff adhered to infection control protocols, such as hand hygiene, sterile delivery techniques, and timely antibiotic administration. So basically, they have a protocol for managing postpartum infections in the labor room. And then what happens? They are looking at whether these protocols are being adhered to. And this is in one hospital, in one, they haven't mentioned, but this is in one hospital. So basically, this is an example of an audit, right? So there is already a protocol in place. So they are just looking at whether people adhere to the protocol. So this should answer our first stem, where this doctor, new doctor at a diabetic clinic, wants to find out whether patients with diabetes manage their blood sugar levels well. And there she wants to check the fasting blood sugar and HbA1c levels. So what is she looking for? The diabetic control of her patients. So this is not whether they are managing the patients correctly. She's just looking at whether the diabetes has been well managed. So there are so many other factors which contribute to management of, which contribute to blood sugar levels. So this is basically an example of a research. What she's doing here is a research. This is not an audit because she's not comparing with any standard procedure, any protocol, any checklist, nothing like that. So this would be false. I hope that's clear. And just for for your knowledge, if you have any questions at any time, you can just unmute your mic and ask any questions that you have. So moving on, how to do a research. So we'll just briefly go through these steps. So basically, when doing a research, you have these 10 steps which you do, right? So these 10 steps, there might be some variations with regard to some studies, but basically, these 10 steps you have to follow in order. And you start off with what? Identifying the problem. So first of all, you need a problem to do a research. You can't just do a research because you feel like it. So your research must be based on an actual gap in the knowledge. So there must be something that has not been discovered. It's no use of doing a research on something that is already known, right? So you are not expected to do that. And once you, there's one step in your research where you have to get authorization, approval. So there's something called an ethics review committee. There are some, and in institutions there will be review boards. So you have to submit your research to these boards, to these ethics review committees. So these committees will evaluate whether you are doing something that is necessary. If you are doing something unnecessary, they will not give you approval. So that is why this is important. You need to identify a gap in the knowledge, a gap in the need of the population, or some sort of policy requirement for you to do the research. So that's the very first step. Then, after you identify an actual gap, you find that there is an actual gap, you find that nobody has done any research regarding the control of diabetes among patients coming to diabetic clinics. Then what do you do? Next step is to do a literature review. You should go back, you should go into certain literatures. You can look at published research regarding that topic. You can look at even unpublished research, research which is ongoing. There are databases for these as well. Then you can talk to content experts. That's also part of that review. You can talk to experts in their field who will know about this topic. And what is expected is you to refine and identify and confirm that there are gaps. Sometimes there might have been researches done in other places regarding this topic where you might not know of it, but once you do the literature review, once you go through those databases, you will find that other people have done research on this. Then you can refine your research question. You can refine your research, and you can identify any controversies, and you can identify any unanswered question regarding your topic. So that is the second step. So you have to go into these certain databases which have published articles on it. You can talk to content experts. You can review other literature and basically identify and refine the gaps you have previously identified. Next, you have to develop your objectives and hypotheses. So objectives are basically what you expect out of your research, right? So there are general objectives and specific objectives. General objectives are for your entire research, and that you can divide into specific objectives. So for that research I mentioned earlier, you can measure you can measure how well people have controlled their blood sugar levels in your clinic. And the next objective can be to find out factors associated with it. You can find out what are the factors associated with good glycemic control. That can be the second specific objective, right? So like that, you can have general and specific objectives, and you can also have hypotheses. So we will look into hypotheses as well. So basically, so simply put, a research hypothesis is it's a statement which predicts the outcome of a study, right? So for example, and if you are looking into factors associated with poor outcome, you can say something like poor socio-economic status or poor or low income levels is associated with poor glycemic control. So that would be a hypothesis, and you do that before you start the research, right? And in the research, what you are going to do is either prove your hypothesis or disprove your hypothesis. So you have to generate your objectives and hypothesis beforehand. Next is you have to choose your research design. So there are these different study designs, research methods, and we will look into these different study methods later. So choosing your study design depends on some factors which we will go into later. So next, once you choose your study design, so you will learn that there are different study designs. There's something called interventional studies. You might have heard of clinical trials. So there are other studies called observational studies, descriptive studies, analytical studies. So we will go into this one by one in a little while. Then you have to develop something called the research methodology, which means you have to select the study population, which means where, in whom are you going to do this research? Are you going to do it in a population and people coming to the hospital, or are you going to go into the community, into homes, and you're going to do your research there? You can decide about the study period, how long you are going to do it for. You can decide what tools you are going to. Are you going to do interviews? Are you going to give them a questionnaire? All of those things comes next under developing a research methodology. Next, there is sampling, where you sample your research population, which means you recruit people for your study. So there are different sampling methods as well. So that is something that we will not discuss today, but you have to know as well. There are different sampling methods. And then finally, we come to data collection. You go out and collect all these data. You use certain data collection tools and methods, interviews, questionnaires, whatever, and you collect the data you need for your research. Next, you analyze that data. The data you have collected, you analyze using certain analytical methods. And that's where statistics, you need to know statistics. This is where statistics comes in. And basically, you use statistical methods to analyze the data. But there are other methods as well. So you use statistical methods most often for quantitative data, which means numerical data. And there are other methods as well for qualitative data, which we will not go into at this level. But basically, no, you can use statistics to analyze quantitative or numerical data you have collected. Finally, you come to interpretation, where you interpret your findings and you discuss you go back to your research problem, the identified problem, and try to see how your findings correlate with, or try to answer your initial research question with the findings you have found. And then a next final important step that some people forget is dissemination. After you have done a research, it is vital, it is very important that you present it or you publish it somewhere. You have to disseminate it to the wider population. This is very important, and that's regardless of the result. Sometimes you can have a negative result. Your research has not uncovered anything. Even that is a significant thing. So you can publish that, even negative results you can publish, and you are expected to. So once you publish that, then another person knows, okay, this person has done this research and they have not been successful. So then they know they have something to build upon. So that dissemination part is also very important. So basically, these are the 10 steps of doing a research. So ideally, you should go step by step. You can't jump in from the middle. So in this question, the first step of Dr. Kalani. So Dr. Kalani wants to find out the factors associated with good glycemic control. So the second step says the first step of Dr. Kalani would be to decide on study methods. So that is wrong. Before study methods, so she has identified the problem. She might have identified the problem. So she wants to find out factors associated with good glycemic control. There's no mention on whether she has identified a problem, whether there's a hint that some people have bad glycemic control, or rather poor glycemic control, and those people appear to be from a poor socioeconomic background. There's no this thing. But the next step should be always be a literature review. Even if she found a problem, she should go into the literature, she should look at these databases, she should talk to content experts and see whether such research has been done. Sometimes this research might have been done in the same hospital, in the same units, with the same patients before she had come. So always the first step, you identify the problem. Second step is a literature review to find out, to refine your research question and to find out existing gaps, to find out whether other researches has been done or some researches are ongoing. And you can also always talk to content experts. Right. Next, we'll come to our main topic, which is study designs. So study designs are basically frameworks, or these are overall methods which we use in a study, which determine how the data will be collected and how we carry out the study. So you might have heard these different terms: cohort studies, case control studies, randomized control trials, systematic reviews. case studies, cross-sectional studies. So you might have heard these different terms. So in order to understand all of these, it's easy if you go in a sort of framework. If we have our own sort of hierarchy. I'm sorry about the disturbances. It's easy if you have a sort of hierarchy to these study designs. So let's go step by step. So we call these studies, we call researches done with, for medical reasons, we call these epidemiological studies. Epidemiological study designs, we first divide into two. We have something called primary studies, and then we have something called secondary studies, right? So primary studies basically are studies where the researcher collects new data directly from the participants or sources, right? For example, imagine you are an investigator and you want to find out whether metformin or sitagliptin is a better anti-diabetic drug, right? So I'm just forget about the medicine background for a minute, and I just want to take an example of this. So just imagine you want to find out, you are an investigator and you want to find out whether metformin or sitagliptin has a better glycemic control effect. So what you do is you prescribe metformin to a group of people and you prescribe sitagliptin to another group of people. And then you follow them up and look at their diabetic control. Then what you are doing is you are collecting your data directly from the study participants, right? You are giving them the drug, you are looking at their diabetic control, and then you are directly collecting that information, and then you can make a certain decision about those two drugs. On the other hand, a secondary research would be where you don't do that. You don't go out and do your research. Rather, you take researches which have been done in other places about this topic. So there might have been a study done in England about comparing metformin and sitagliptin. Another research in Australia. Another research in Canada, wherever. So you have these different researches done in different places. And what you do is you don't do a new research, you don't go out and do these drugs. You take those already done researches and you consolidate them, or you make a summary of those researches. You combine all of them to make a single conclusion. So secondary studies, you don't go out and collect data. So primary studies, you went out and collected data directly from the source. Secondary studies, you do not go out and collect your data, collect the data yourself. You rely on other people's data, other people's literature, other people's studies. And what you do is you take them all together and you consolidate them and you summarize them to give one conclusion. So you might have already heard this. So systematic reviews are a type of secondary studies. And within them, you might have also heard about this term, meta-analysis. So it's important for you to know a little bit about this. So systematic reviews, like I mentioned earlier, these are structured summary of multiple studies on a specific research question. Like I told earlier, you can have the same thing. You can have this study comparing two drugs done in different locations, done for even different groups even, and then you can consolidate them into one study, right? So in that consolidation, the analysis part, it is in the analysis part, for a systematic review, you go by a special name, which we call meta-analysis. So the meta-analysis is the analytical component of a systematic review, which is used to combine different numerical data. For example, in a study done in England, they might have found that metformin reduces the blood sugar levels by 10 units more than sitagliptin. In another study in Japan, it might be 6 units. In another study in USA, it might be 9 units. So to combine all these numerical things, you use this special method called meta-analysis. So it's not simply averaging those values. It's much more complicated than that. You have to look into different aspects of each study. So that analytical component where you combine this numerical data from multiple studies, that is what is called a meta-analysis. So meta-analysis is in fact not a different type of study. It is the analytical component of a systematic review. So the systematic reviews are the example of a secondary study. Right. I hope that's clear. So moving on, let's go and look at primary studies. So primary studies in themselves then can be divided into again into two. These are observational studies and experimental studies. So to understand the difference, imagine again you are an investigator and you want to find out again whether sitagliptin or metformin is a better diabetic, has a better diabetic control. So what you do is you take two doctors who are prescribing metformin as the first line and another doctor who is prescribing sitagliptin as the first line. So you already have two doctors out there who are prescribing these drugs to their own population. So one doctor is prescribing metformin to his patients, another doctor is prescribing sitagliptin to his patients. And what you do is you observe these event. So you observe this doctor prescribing metformin and you see the glycemic control in this population. And next, in this population, you see whether sitagliptin is how well sitagliptin controls blood sugar. So what you are doing is simply observing how these two drugs control diabetes in these two groups. You are not intervening. On the other hand, another way you can find this data out is if you take these two drugs, you take a group of people and you divide them into two groups and you prescribe them metformin and sitagliptin. You prescribe one group metformin, you prescribe another group sitagliptin. So now what you are doing, you're not simply observing, you are intervening. You're going in and you're prescribing. You are saying you have to take metformin, you have to take sitagliptin, you have to take metformin, and so on. So you are actively intervening and changing who gets which drug. So that is an example of an interventional study. On the other hand, where you are only observing other people prescribing the drug and you are just looking at the glycemic control afterwards, you are not intervening, that is an observational study. So basically an observational study is where the investigator simply observe how events naturally occur in the world without interfering and changing any variables. You are simply observing. In an interventional study, you are intervening, you are actively intervening and changing certain variables in a way that would not normally happen. So those patients, they would not normally take those drugs. They would be taking some other drugs depending on which doctor they go to. But you, on the other hand, you take these people and then you divide into two groups based on some criteria, maybe even randomly. So that's where you get this term randomized control trial, where you randomly allocate patients into different groups and you decide which patient takes which drug. So that is an example of a interventional study. So there's an oversimplified example of the difference between observational studies and interventional studies. I hope that's clear. So interventional studies, they are a big group of studies. So there's something called randomized control trial, which are the gold standard of interventional studies. So we will not be discussing that here because that's a large topic on its own. So let's go ahead with observational studies. So observational studies, again, they can be divided into again two. So they can be descriptive studies or analytical studies. So basically descriptive studies are studies where the investigator observes and describes the event, right? It describes what? The distribution and amount of a health event. So basically they are describing what? Distribution means time, place, and person. So descriptive observational studies simply observe and describe a certain health event in a population. So something like this. So this is a case report on a single disease, right? So this is a case report on minimal change disease in treatment native hepatitis C virus infection, right? So this is a case study and we will learn what case studies are. Then you have this sort of thing, which is chronic obstructive pulmonary disease prevalence in Lebanon, right? So this is simply looking at the distribution of COPD in a certain country. So this had certain graphs like this, which show the distribution of disease over age, which is distribution across person. And then you had this as well, which described the different symptoms coming in different stages of that disease. So basically, this didn't look into any factors associated with this disease. These studies did not look into what caused COPD, what caused exacerbations of COPD, or what caused deterioration of COPD. They looked into only the distribution in time, place, and person of this disease. So that's an example of descriptive studies. They are only describing. On the other hand, and the uses of descriptive studies is to find affected people and high risk population. Like I said, we look at the distribution in person, and via that we can find out who is at higher risk, who is more affected, and we can start to generate a hypothesis. Right? We can't test a hypothesis, but we can use this data to generate a hypothesis. So, for example, if we find out that COPD, or rather, severe COPD is more common in higher age groups, then we can generate a certain hypothesis regarding that. Sorry. So moving on, analytical studies. On the other hand, analytical studies, these investigate the association between a risk factor and outcome. So now we are going into testing of a hypothesis. So basically, analytical studies look at two variables and see whether there is an association between these two variables. So these variables are usually called exposure and outcome. For example, smoking can be considered an exposure for lung cancer. And what an analytical study does is it tries to see whether there is an actual association between smoking and lung cancer. Another thing, unhealthy diet. An unhealthy diet can be a risk factor for diabetes. A diet rich in with excesses of sugar can be a risk factor for diabetes. So the diet high in sugar is the exposure, is the probable exposure, and diabetes is the probable outcome or the disease. And what analytical studies does is it tries to find whether there is an actual association between unhealthy diet and diabetes, whether unhealthy diet actually causes diabetes. So that is what analytical studies do. So descriptive studies, they only describe what is happening. Analytical studies go into detail to find this association between exposures and outcomes. Right. So an example of an analytical study would be something like this. So this is a study which goes into, let me just erase this. Right. So this is a study which goes into look into what is the cause of thyrotoxicosis. So this is analytical study which looks at factors associated with factors causing thyrotoxicosis. So the use of analytical studies is to test the hypothesis, right? So that is very simple. Descriptive studies describe a certain health event and generate a hypothesis. Analytical studies, they test that hypothesis. So now you can answer this question as well. So Dr. Kalni wants to find out the factors associated with good glycemic control in that same clinic. So then she wants to find out the factors associated with. So she wants to find out what exposures affect glycemic control. So this is an example of a what? It's an analytical study. It's not a descriptive study. So this would be false. So then again, descriptive studies and analytical studies, there are different types. And you will need to know a little bit about each of these. And these are the studies I mentioned. You need to know a little bit about the advantages and disadvantages of, because these will be asked in your exam. These are very common things that can be asked. You need to have a basic understanding of these different study designs or the study methods. And so basically in each of these groups, you have three. You have three descriptive studies and three analytical study designs. So descriptive study designs include case reports, case series, cross-sectional descriptive studies, and something called ecological studies. On the other hand, analytical studies are, sometimes you might have heard, cohort studies, case control studies, and cross-sectional studies with an analytical component. Some literature mention this as analytical cross-sectional studies as well. So for each of these, you need to know a little bit about what this study is and what are the advantages and disadvantages. So then first off, case reports and case series. So these are the most basic type of descriptive studies. A case report or a case study is a detailed report into one patient. You take one patient with a certain disease and you generate a detailed report. What are the presenting symptoms? What is the all those basic details, age, gender, those things are there. And then what are the presenting symptoms? What were the investigation? How was the progression of the disease? What are the different investigations that were done? The pathological, the hematological investigations, the biopsies, then a detailed description of what happened to the patient, the management of the patient, and the final outcome of that patient. So case report is a very detailed document on a single patient, and usually it's a new or unusual presentation of a disease condition. It's not something that is routine. It's an unusual presentation of a disease which we usually use to generate a case. We usually write case reports on unusual or new presentations. And what a case series is basically a collection of individual case reports. So you take case reports done on several patients and you combine them on several patients with more or less the same disease or disease presentation, and you combine them into a case series. So that is how and that is what is known as a case series. So basically, you have case studies and case series are the most basic level of descriptive studies. And so one of the famous example is this case series, which came out in 1980, which describes pneumocystis pneumonia in 5 people, all of whom were homosexuals. And this report was one of the very first researchers which uncovered the cause of AIDS as HIV infection. So this was one of the very first researchers done into HIV and AIDS. So this is what started all of the investigations, which later led to discovering that the HIV virus caused this condition which leads to acquired immunodeficiency. And this is something it's very famous in epidemiology. So like I said, these sort of descriptive studies, they generate a hypothesis. Using this sort of case series, they came out with certain hypotheses, which they later used to test out and actually find out that the HIV virus is the cause for this acquired immunodeficiency. So moving on, the use of this is so there are two main uses rather. So the two main uses are, one, it helps to identify unusual clinical presentations of a disease. So if there are, very rare clinical presentations, very rare variants of a disease, by reporting this disease, then other people can also know about this disease and they can know what you did, what was successful and what was not. And the second one is, like I mentioned earlier, this may lead to formulation of hypothesis. Disadvantage is you cannot establish causation. Like a case report is just one look into one patient. You cannot say what is the cause for that disease from that one patient, and because of that, you can't generalize to other people. Just because this patient has these symptoms and this presentation doesn't mean you can tell that other people will also have the same thing. So that is what is meant by generalizability. Generalizability means how much you can take the findings of your research and apply it to the wider population. So a case study, look into one person, the findings from that you can't apply to a wider population. So that is all for case studies. Then cross-sectional studies. So cross-sectional studies are basically are also called snapshot studies. So these are studies where you take a snapshot of the population at one point and you describe the features of that population of that time. For example, right now, you could take a snapshot of all grade 10 students in Sri Lanka or even in Colombo. Just take all the grade 10 students in Colombo, and then you can describe their features. You can tell how many males there are, how many females there are. Then you can tell things about, for the grade 10, we do something called SMI, school medical inspection. So if they have done like that, they will have found certain health defects. So you can tell then how many of them have visual defects, how many of them have dental caries, all of that you can do through a cross-sectional study, which means at a single point of time or over a very short period, you describe the features and characteristics of a certain health condition or disease in a population at a single point in time. That is what you do. So this is an example of such a cross-sectional study. They have looked at the prevalence of CKD in China. So this was a cross-sectional study. At one point in time, they took a sample and they looked at the prevalence of this CKD in that sample, and they looked at other factors as well with regard to the chronic kidney disease. How many of them had symptoms? How many of them being managed by a certain under a certain management protocol? All of these things at a single point in time. That is what is meant by cross-sectional study. So the advantage of cross-sectional study is, again, this is a cross-sectional descriptive study. The advantages are this is quick and inexpensive because it's a snapshot. All you need is one go in this. So they are usually very quick and inexpensive. And you can measure something called prevalence. So we will look into prevalence later, what prevalence is. But basically, what prevalence means is that how many cases there are of a certain disease in the population. If you take 100 people, how many people right now have cancer? Out of those 100 people, how many people have cancer? Or how many people have diabetes? So if you have 40 people with diabetes, the prevalence will be 40 out of 100. So prevalence means the number of existing cases of a disease among a population. So cross-sectional studies can measure prevalence. Why? Because it's a snapshot. It takes the feature of a disease or health event at a certain point in time. And you can use this to generate hypotheses. And this is also useful for public health planning. Like once you know there are this many patients with diabetes, you can make certain programs to address those. So knowing the prevalence will help you with planning programs for these people. The disadvantage is, like I've said earlier also, we are not looking into factors associated. We are not looking into associations in descriptive studies. So you cannot establish causation. And then the other disadvantage is something called incidence. So this is the other measure that you need to learn about, and we will learn about this later. So basically, incidence means the number of new cases of a disease which happen in a certain population. So because you are looking at this disease at a single point in time, you cannot measure the incidence. You cannot find out how many newly diagnosed patients come up. To measure the incidence, you need to follow up a population for a period of time. Then you can see how many patients are newly diagnosed who newly develop that disease. So because you are doing it at a single point in time, you cannot measure incidence. So incidence is the number of new cases of a disease which happen over a certain period of time in a population, and you cannot measure this in cross-sectional studies. So then the final type of descriptive study is something called ecological studies. So ecological studies, what ecological studies do is they take populations and they compare the characteristics of those populations among each other. So one way to think about is, think you have a population and you have two characteristics of that population. And then you graph those two characteristics on such a graph. For example, or we'll look at the example later, and then you take different populations. So A can be one country, and then you take other countries as well, and you graph their characteristics on a graph like this as well. And then you can compare these different patterns. So an example would be something like this, which they have done. They have taken different countries and they have looked at their in those countries, the average meat consumption, how much meat they consume, and then also what is their colon cancer incidence, right? So they have looked at the meat consumption, how much meat they eat, and they have looked at the colon cancer rates in the population as well. So in this, you can see that some countries which have higher meat consumption, which consume higher amounts of meat, also have higher amounts of colon cancer. And some countries which have lower consumption of meat have lower colon cancer incidence as well. So this is an example of an ecological study. So ecological studies are basically studies that use aggregate data or population level data. They compare populations to examine certain association between exposures and outcome. However, they are not establishing association. That's the key thing. They are simply examining an association. Why? Because they are looking at population data. So for in this example, if you take a population, there might be some people who eat meat and there might be some people who do not eat meat, right? So you are making a certain assumption about that entire population. So that is why you cannot make associations. For associations, you need to go to individual level and see. Sorry about that. So ecological studies, they do not establish associations. They simply examine the association that there is already. So that is why this is classified under descriptive studies, right? So the features of this are they use population level data. They do not track individuals. And because of this has certain advantages and disadvantages. Sorry about that. I'm still recovering from a bad cough. So basically, the advantages of an ecological study is one, you're already using available data. So this is going to be quick and inexpensive. This is data that is already available. Then you cannot test a hypothesis, but you can generate a hypothesis, right? Similar with the other descriptive studies, you can generate hypotheses regarding certain associations. And then you can examine large scale trends. Disadvantages, there's no individual level data. Because of that, you cannot establish associations. I hope that's clear. So these three are the examples of descriptive studies. Case reports, case series, cross-sectional descriptive studies, and ecological studies. Then let's go on to analytical studies. So basically descriptive studies, they generate the hypothesis. Analytical studies, they test that hypothesis. So these analytical studies that we are going to look into, they have an exposure, they have a presumed exposure, and they have an outcome. And what these analytical studies do is they try to establish the association between the exposure and the outcome. Right, so the very first study we are going to look into is cohort studies. So a cohort study, so you have these three studies: cohort studies, case control studies, and cross-sectional studies with an analytical component. So in cohort studies, what you do is you recruit based on exposure status. So what does that mean? So if you take the example of smoking and lung cancer, so then in this example, exposure is smoking. Smoking is the exposure. Lung cancer is the outcome or the disease. So in order to do a cohort study to examine the association between smoking and lung cancer, what you can do is you can take a group of smokers as the exposed group, and then you can take a group of non-smokers as the non-exposed group. That is your starting point. Your recruitment is based on exposure status. And then you follow them up to see how many of them develop lung cancer. Do you get my point here? So you start off with a group of exposed people and unexposed people. You start off with a group of people who are smokers and a group of non-smokers. And then you follow them up for a set period of time, 10, 20 years, and you see how many of these in either group develop lung cancer. So then basically you will have people in the exposed group developing lung cancer, and then you will have some in the non-exposed group as well developing lung cancer, because the only reason for lung cancer is not smoking. There can be other reasons as well. So basically, you follow the smokers and non-smokers up, and you see how many of them get the outcome of lung cancer. So if the lung cancer rate was more in the exposed group or the smokers, so if the lung cancer incidence or the cases of lung cancer were more in the exposed group compared to the non-exposed group, then then you can tell that smoking contributes to lung cancer, or smoking is a risk factor for lung cancer, right? So I hope that's clear up to now. Cohort studies, you start off with the exposure, smoking and non-smoking, and then you follow them up until you get the outcome, right? So then I hope that's clear. So I'm going to make it a little bit more complicated. Even in cohort studies, there are two types. There's something called prospective cohort studies and retrospective cohort studies. So prospective cohort studies are studies which at the start of the study, the exposure has happened, but the outcomes haven't happened. You get my point? So you start off with, this is the example that I mentioned earlier. You start off with a group of people who are smokers and non-smokers. They haven't developed lung cancer yet. They don't have the outcome yet. And then you follow them up for a period of time. This can be 10 years or 20 years. And the end of those 20 years, some of them might have got lung cancer, right? So then this is an example of a prospective cohort study. So then what is an example of a retrospective cohort study? So what do you expect to happen in a retrospective cohort study? Right, sorry about that. So that is an example of a prospective cohort study. Retrospective means the start is at the end. The exposure and the outcome has already happened. But the process doesn't change. So an example of this would be, if you did the research 20 years later, now people have already got lung cancer, but they go back and they look at the medical records of these patients, and then you divide those patients into two groups: people who are smokers and people who are non-smokers. Their outcomes have already happened. People who have got lung cancer have already got lung cancer, but you have their medical records. So you go back into the clinic records and you see how many patients there are, and let's just imagine their smoking status is also mentioned. So you can divide these patients into smokers and non-smokers. And then the outcome has already happened. You see how many of these people have developed lung cancer. So that is an example of retrospective cohort study. So a retrospective cohort study means at the start of the study, at the initiation of the study, both exposure and outcome have happened. So that is the difference between a prospective cohort study and a retrospective cohort study. So prospective cohort study, outcome hasn't happened. You start at the level of the exposure and you follow them up until the outcome happens. Retrospective cohort study, exposure and outcome have happened, but you go back and divide the group into two at the very beginning. So you might need a certain document with the exposure status listed. So this can be a clinic register with the exposure status given, smoking status already given. So you use that register to divide these, to get these two groups, because that is what a cohort study is. Cohort studies always start with exposures. So you divide into people with the exposure, without the exposure, and you follow them up until you get the outcome. You don't follow them up, they have already happened, but you see how many in that group, how many in the exposed group have the outcome, and how many in the non-exposed group have the outcome. And you can compare this, like I mentioned earlier, and you can come to certain conclusions. So that is the difference between a prospective cohort study and retrospective cohort study. So prospective cohort study, you have to follow them up for a period of time. So we have looked into the difference between prospective and retrospective. So the steps of a cohort study, very briefly. First, you identify the suitable cohort, which means you identify the exposed and non-exposed group. Then you identify a suitable comparison group, which is the people who are non-exposed. Then you collect data on their exposures, you establish the exposure levels, and then you follow them up until the outcome, and then you analyze the data very briefly. So the advantages of a cohort study. So this you need to know. So a cohort study, like I said, you start off with an exposure, and then you follow them up until they get an outcome. So this is the classical prospective cohort study. So if you do that prospective cohort study, you will get a complete description of all the things that happen in the natural progression of that disease, right? So all the things that happen in this disease, all the complications that happen, the time frames in which they happen, all of them you can know in a prospective cohort studies. Why? You are following them up longitudinally. You are following them up into the future, right? So that is one advantage. You can get a very detailed history about that disease. Next, you can establish something called temporal association. So what is temporal association? So temporal association means the exposure. If you are trying to find out whether something is something is an exposure for disease, it is important that that exposure happens before the disease, right? So that exposure can't happen after the disease. For example, if you have a smoker, and if you think that so if you have a patient with lung cancer, and if you think that patient developed lung cancer because of smoking, that patient should have started smoking before developing lung cancer. Then you can, that's somewhat of a clue that the smoking causes lung cancer. So then you can establish a temporal association. Why? The exposure came before the outcome. The cause came before the effect, right? So in cohort studies, because you're starting from the exposure and then you're following them up until outcome. At the beginning, you didn't have the outcome, you only had the exposure. Then you follow them up until you got the outcome. You can establish this temporal association, which means the exposure happened first and then later only the outcome happened. So only in prospective cohort studies can you establish this temporal associations. Another advantage is you can study rare exposures. So rare exposures, you can sort of get them out and investigate them. So even if the exposure is rare, if you can find that exposure, you can find a group of those people and put them in that group, and you can call that the exposed group. And then you can find a group of people without the exposure, and they will be the non-exposed group, and then you can do the study. Then you can look at multiple effects of an exposure, because you are taking one exposure and following them up, even if other outcomes happen. If you take smoking, you follow them up and you find that they get cancer of the mouth, oral cancers as well. So that's another outcome. So you can do a study on that as well. So you can study multiple effects of a single exposure. And this also allows you to calculate incidence rate. So like I mentioned earlier, we will look at incidence rates later. But basically, because you follow these people up, you can find the occurrence of disease as well. So these, like I said, to incidence is the occurrence of new cases of a disease. And for that, you have to follow people up. And so to calculate incidence rates, you need to follow people up, and cohort studies do that. So through cohort studies, you can calculate incidence levels. I hope that's clear. So the disadvantage is that cohort studies are time consuming. You have to follow them up for a long period of time. They are expensive. They are not always feasible. So it's very time consuming, expensive, and very difficult to carry out. Then there is this thing called loss to follow up. This is also called attrition. Attrition. So basically, this is because you follow them up, some people might get lost, right? So you might not be able to contact them. They might move out of that area. They might change their phone numbers. And because of all this, you lose contact with them, and you might not be able to follow them up. So this is a problem in cohort studies. This is an important problem in cohort studies. This is unique to cohort studies as well, loss to follow up or attrition. And this is unsuitable for studying rare diseases as well, right? And then changing in the exposure status, if not accounted for, will affect the trial, will affect the study. So we are assuming that if we look at smoking and lung cancer, we make certain assumptions that smoking will remain the same. Right? If you classify that person as a smoker, we expect that person to smoke at a same rate throughout. But sometimes that might not happen. Practically, that will not happen. So there might be fluctuations as well. So you need to take this into account, right? If you take it into account, that's fine. There are different methods. You don't need to know them, but just know that has to be taken into account. And the study itself might affect outcome. When people know that they are being investigated for, when smokers realize they are being investigated for the occurrence of lung cancer, they might change their behaviors. So that is another disadvantage. So those are the advantages and disadvantages of cohort studies, and you need to be have a brief understanding of that. Next, regarding the analysis, we will not go into detail about this, but just know there are two ways of analysis, and we look into this in the statistics module. So basically, you have something called tests of significance or hypothesis testing, and you have to do this for all analytical studies. And what you do is this is the way you establish the association. You have the hypothesis, this is the way you test that hypothesis. You call these tests of significance or hypothesis testing. And the second analysis, so there are two analyses you need to do. One is to establish that there is an association between the exposure and the outcome. The other is to measure that association, to give a figure to that association. If you smoke, your lung cancer risk will double, or your lung cancer risk will go up by 300%, whatever. You can give a number to that as well. The first one, through hypothesis testing or test of significance, they only tell that smoking will cause lung cancer or smoking will increase the lung cancer. It doesn't tell by how much. Measures of association you will learn gives the numerical value by how much the exposure will increase the risk of getting the outcome. So the measure of the important thing here is that for you to know, just know this for now. For cohort studies, the measure of association, which gives the numerical value, is something called relative risk. Right? Just have it in your mind for now. We will go into detail in later sessions. So next, that is all for cohort studies. So like I said, cohort studies, they start off with exposure levels. You have people with the exposure, without the exposure, and you follow them up until they get the outcome. Case control studies are the exact opposite. They choose subjects based on their outcome status. So basically, you start with people with the outcome or without the outcome, right? So in this, the example, same example we gave earlier, this would be you start off with people with lung cancer and without lung cancer, right? And then you see among the people with lung cancer, how many have smoking, how many have a history of smoking. Among the people without lung cancer, how many of them have a history of smoking, right? You choose the subjects based on their outcome status, right? So that is the difference between a case control study and a cohort study, right? So if you do like this, basically you will have in the people with the disease or with lung cancer, you will have some people who have smoked and some people who haven't smoked. In the people without lung cancer, you will have people who have smoked and who haven't smoked. And by comparing these two, in the people with lung cancer who have smoked and in the people who have not smoked, sorry, in those who don't have the disease but still smoke, by comparing these two values, you can come to a conclusion on whether smoking is associated with lung cancer. So in addition, the special term we use for people with the outcome and without the outcome are cases and controls. People with the outcome, the with the people with lung cancer, we call them cases. The people without the outcome, the people without any lung cancer, we call them controls, and that is where the name comes, case control studies. So I hope that is clear as well. Case control studies, you divide subjects according to the outcome, according to the disease. So the example I gave was actually from here. So they have actually done this study where they have taken a group of people with lung cancer and another group of people without lung cancer and looked at their past history of smoking, and they established the association between smoking and lung cancer. And this is that research article. So basically, that is how we do a case control study. That is the basis of doing a case control study. So there are a few steps of doing a case control study. So we will briefly go through these as well. First of all, you have to choose your cases. Next, you have to choose your controls. And then there's something called match. And then you will go back and measure the exposure status. You look at the smoking status and then you analyze. So the first step is you have to select the cases, and there are some things that you need to be aware of. These cases need to be homogeneous as possible, which means they cannot be very different from each other. So even in lung cancer, these should be as homogeneous as possible. It's better if you have lung cancers of the same pathology. So if you have small cell lung cancers, it's better to have that same pathology in all those cases. Next, you need a case definition, right? For the cases, you need a strict case definition, and this will affect these cases to be homogeneous, right? And then you have to decide on the source. You can have hospital-based cases or community-based cases. You can take these diseased patients from the hospital or the community. That is, there are different advantages and disadvantages to both. And then an important thing is you have to decide between incidence and prevalent cases. And we will look into this later, what is incident case and prevalent case later onwards. But basically an incident case means a newly diagnosed patient, while a prevalent case is someone who has been diagnosed earlier and has been living with that disease for some time now. So we prefer, so before, just for your knowledge, we prefer incident cases when we are doing case control studies, because prevalent cases, after some time, some people might have got other complications or they might have died. So you might not get the full information you need from prevalent cases. So we prefer incident cases in case control studies. So when we select, next, we looked at how we select the cases. Next, we have to select the controls. So the controls should be similar to the cases. Only difference is they should be not having the outcome. So the example with lung cancer and cancer. So the patients with lung cancer the patients without lung cancer should be more or less similar to the patients with lung cancer. They should be the same age, same gender, same socioeconomic background, and the only difference should be that they don't have lung cancer. That is what is meant by being analogous to the cases, and they should be free of the outcome and comparable to the source population, right? And then you can decide on the source. So the cases you can decide on the source, hospital and community, and then the controls also you can decide on the source. They can be from the hospital or they can be from the community. So the hospital cases have these advantages. You can identify them easily, and because they have a certain disease, some other disease not related to lung cancer, because they are from, you can take basically these hospital controls you can take from patients coming for and something else. The lung cancer patients you can take from the patients who are admitted, and the controls you can take patients coming to the OPD or coming to the diabetic clinic who don't have lung cancer. So they are still coming from the hospital, but they don't have the disease. So hospital controls have these advantages because they are diseased, they have some disease, other disease. They are more likely to recall certain health events, and they are more likely to cooperate, which is the practically most useful advantage. And then going on to their disadvantages is that they are quite different from a healthy population. So the findings might not be valid sometimes, and the disease they might have might be associated with the disease you are investigating as well. So the advantage of a community, so you can take from the hospital or you can go into the community, into the village, and recruit cases as well, recruit controls as well. So community-based controls are good if you want to, like I said earlier, to extrapolate your findings to the general population. The disadvantage is they might not volunteer, they might not be willing to come. So hospital-based controls, they will be more likely to volunteer. Then there is something called matching, which we do for case control studies. So just know this is a technique which we use to try to make the controls as analogous to the cases as possible. So we purposefully choose the control cases. So if the cases are mainly from aged between 20 to 25, we try to select controls also between 20 to 25. So that is an oversimplified example. You can do matching on an individual basis, which means if you choose a case who is 45 years, then you choose a control also who is 45 years. That's a case of individual matching, right? Or you can do group matching, where you try to match the characteristics of the entire group to the other group. So just know that matching is a technique which you use in case control studies to make cases and controls comparable. Simple. Right. I hope that's you have understood that. And the analysis here also more or less similar. You have tests of association, which is the hypothesis testing, and measures of association, which you use to establish an association between the exposure and outcome. So you do those for this as well. Then you have to do measures of association as well, which is to find out the numerical value, or how much the exposure causes the outcome, or how much the exposure causes the outcome to go up or down, right? So those are called measures of association. So for case control studies, the measure of association is odds ratio. For cohort studies, it was relative risk, right? So that is an important thing to note. We will look into these later. So case control study, the advantage is, this is the opposite of the cohort study disadvantages. So cohort study disadvantage was they are time consuming, difficult to do, have a high cost. The advantage of a case control study is the exact opposite. They are time efficient, they are easy, and they are cost effective. Why? The outcome has already happened. The exposure has happened and the outcome has happened. All you have to do is go back and look at the exposure levels. So this can be done in a short period of time. So this is also very good for studying diseases with a long latency period. If you do a cohort study for this, you have to wait for a long time. If you try to find out whether a certain thing causes cancer, or if you want to see whether, like, for example, HPV infection can cause cervical cancer. If you are going to do a cohort study for that, it basically HPV infection over 20-30 years causes lung cancer. You need the HPV infection over that long period. So if you try to do a cohort study for that, you will have to follow these patients up for 20-30 years. So this is better if you want to do in a shorter period of time. Rather than following those patients up for 20-30 years, you take patients with cervical cancer and then you look back to see whether they had an HPV infection earlier, so that you can save time on that. And this is good for rare diseases. So you can choose the diseases, you can choose people with the disease, and you can choose people without the disease. So this is good for rare diseases. And this is also good for studying multiple exposures. So cohort studies was good for examining or studying multiple outcomes. On the other hand, case control studies are good for examining multiple exposures, because you start from one outcome and then you can look back at multiple exposures. And attrition is not a problem. So loss to follow-up will not be a problem because you are not following them up, right? The disadvantages is there are something called biases in research, which we look into later. So in case control studies, there are lots of biases, right? So biases are a significant problem which affect the validity of the studies, and we will look into those as well. Just know that case control studies have more biases compared to cohort studies. And you cannot calculate an incidence rate. Like I mentioned earlier, to calculate an incidence rate, you need to follow up for a period of time. So since you are not following up, you cannot calculate incidence level, and you cannot establish a temporal association. So like I said, the temporal association means exposure comes first, then the outcome happens. So if that happens, this is a temporal association. Since you are doing a case control study after the outcome has happened, you don't know whether there was the exposure happened before the outcome or not. You assume that the exposure happened, but there's no way to verify that the exposure happened before the outcome, because at the time you recruit that person to that study, the exposure and outcome have both happened. So you cannot establish a temporal relationship, and you cannot do for multiple outcomes, because you start with only one outcome, and one group with an outcome and one group without an outcome. You cannot study multiple outcomes. So those are the advantages and disadvantages of case control studies. And I hope that's clear. Right. So then the last one is cross-sectional studies with an analytical component. So this is very simple. So remember we talked about a cross-sectional study. A cross-sectional study is where you take a snapshot. You take at a single point of time, you take a group of people and you describe their characteristics. So in this study, you can do an analytical, you can add an analytical component as well. So basically what that means is you can take, if the exposure and outcome have already happened in that group, you just take these people out and then you will have these different groups. You will have a group with exposure and outcome present. You will have a group with exposure and outcome absent. Then you will have another group who have the exposure, but the outcome is not there. And then you will have another group, the exposure is absent, but the outcome is present. So you can divide the population into these four. So then you can compare these groups and come to that same conclusion which we did for analytical studies as well. So basically this is an example of something like that. The exposure and outcome have already happened. The exposure was the ABO blood group, and they want to see whether the ABO blood group, the different blood groups in the ABO classification, they are associated with differences in blood pressure. So what they did was they did a cross-sectional study. They took the people at once at one point in time and they looked at their blood group and their blood pressure. So that is an example of cross-sectional study, and they look to see which blood groups, if which blood groups was, which people with higher blood pressure had which blood groups. So this is an example of a cross-sectional study with an analytical component, and like I mentioned earlier, this is more appropriate for studying exposures which are more permanent or chronic. If they have gone on for a period of time, then these cross-sectional studies are more suitable for that. So let's quickly look into the advantages and disadvantages. So cross-sectional study is similar to the descriptive study. You do it at one time, it's a cross-section, so it's feasible, doesn't last a long time, and it doesn't cost that much as well. Then it provides the prevalence of a disease. Similar to the cross-section descriptive studies, once you take a snapshot, you can find out how many people have that disease. That is what is meant by prevalence. And then it's useful for chronic conditions and conditions with a low fatality rate. So if there's a high fatality rate, that means it's kind of like lost to follow up. Then of course you need something like a cohort study, because you will miss them if you take a single snapshot. And then the disadvantage is that since you're looking at a single snapshot, you cannot establish temporality, and it does not provide estimates of that incidence. Conclusions on association need to be interpreted cautiously, right? Like, although we say that you can test associations and you can make certain sort of judgments on the association, these need to be interpreted a little bit cautiously. And these are not suitable for rare diseases, and these are not suitable for conditions with short duration, right? Because it's a single snapshot. Right, so those are the advantages and disadvantages. So now you can answer the final two questions. So case control studies can be done within a short period of time. True or false? True. Case control studies can be done within a short period of time. So what cannot be done within a short period of time? Prospective cohort studies. Why? You are following them up over a long period of time. And then temporal association can be established in case control studies. True or false? False. You cannot. So for temporal association, you need to start off with the exposure without the outcome, and then after some time only you get the outcome. That is the temporal association, and this is you can only establish this in prospective cohort studies, where you go from a status of exposed and then you come to a level of the status of outcome. Then you can establish there is a temporal association between the exposure and the outcome. So basically that is it. So this is what we have learned. So we learned about the definition of epidemiology. We learned that it is the study of the distribution and determinants of health-related events, and the use of that knowledge to control those diseases. And then we learned what research is, that it is a systematic investigation in which generates new information and the findings are you can extrapolate to other populations, and we learn the difference between an audit. So an audit is a review which compares the current management with an established management or a protocol, and that is specific to that institute. And then we learned about the steps of the research, where there's 10 steps. And then we learned that one of the steps was to decide on the study designs. So we learned about the different study designs. At the very beginning, there's interventional studies and observational studies. Observational studies we divided into, sorry, at the very beginning, there's primary studies and secondary studies. Secondary studies were studies which looked into different publications. You relied on other publications and other literature and other sources, and you combined, or you didn't do the research. You took research other people have done and combined them into and consolidated them into one research. Primary research, on the other hand, where you go out and you do the research on your own and you collect data on your own. And primary research, you can divide into these. First of all, interventional studies and observational studies. Interventional studies, you intervene and change variables. Observational studies, you do not intervene, you simply observe. And observational studies, you can divide again into descriptive studies and analytical studies. Descriptive studies, you only describe the data in time, place, and person. Examples are case control, case series, cross-sectional studies, and ecological studies. And analytical studies are where you analyze and try to find the association between certain exposures and outcomes. Descriptive studies, you use to generate hypotheses. Analytical studies, you test the hypothesis. And examples of analytical studies were case control studies, cohort studies, and cross-sectional studies with an analytical component. So I hope you have understood the session up to now. So if you have any questions, you can post them in the chat, or you can ask any questions as well.